Hi, welcome to our channel Know the Unknown, and today we are going to discuss the active ingredient sildenafil citrate, which is commonly known as Viagra or Manforce or Caverta. So let's start now. The sildenafil citrate is available as a 25 mg tablet, 50 mg tablet and 100 mg tablet in a generic form and with different brand names also. For example, internationally we can get the Viagra and Revatio from the Pfizer, and in India the Caverta is available from the Ranbaxy, the Manforce is available from the Mankind, and Penegra from Zydus Cadila. And other than this, the Nicogra, Zeagra, Kamagra, Silagra and Edegra, there are a lot of other brand names also. Now let's see the history of our research. The sildenafil citrate was synthesized by a group of pharmaceutical chemists who were working at a Pfizer sandwich in a Kent research facility in England, and it was initially studied for the use in hypertension and angina pectoris. And Pfizer originally discovered this medication in 1989 while they were looking for the treatment for heart-related chest pain, and later this was approved for the medical use in United States and Europe in 1998. Now we will see the indication where the sildenafil citrate can be used. So sildenafil citrate or a Viagra is used for the treatment of erectile dysfunction, and it is oral drug that is commonly used for the treating impotence. And erectile dysfunction or ED is the inability to attain or maintain the penile erection. And sildenafil citrate is rapidly absorbed after the oral administration, and the average bioavailability is around 41%. And the sildenafil citrate comes in a film coated rounded diamond shaped tablets with the strength of 25, 50 and 100 mg tablets. The mechanism of action or how this drug works. The sildenafil citrate works for men who have erectile dysfunction by increasing the blood flow to the penis, so you can get and keep an erection. Now, the onset of action is within 20 to 30 minutes after taking this drug, and the effect lasts for around 2 hours. So in a normal way, the nitric oxide is released by the nervous system in erectile tissue of a penis, and this nitric oxide stimulates an enzyme that produces the cyclic guanosine monophosphate, which is also called CGMP. This CGMP dilates the arteries in a penis, so the arteries and erectile tissue fill with the blood and the erection occurs. And here the sildenafil prevents this CGMP from becoming degraded, so the blood flow and erection can continue. Now we will see the adverse effect or a side effect. The most common side effect with the sildenafil citrate use or with the Viagra use is the person may get the headache, flushing, indigestion, nasal congestion, and sometimes the person can get the abnormal vision, diarrhea, dyspepsia, sometimes dizziness may occur. Now the next is special precautions. So what are the precautions which we should take when we are taking the Viagra or sildenafil citrate? So better it is don't take the sildenafil citrate if you are having any kind of a bleeding disorder, peptic ulcer, abnormal deformation of a penis, the hepatic diseases, renal impairment, or any history of a heart failure, hypertension, cardiac arrhythmias, cardiac disease. So in all above condition, it is better to avoid the sildenafil citrate use, and better to consult a doctor if you are planning to take. Now the contraindication: if the person is having known hypersensitivity to sildenafil citrate, so he should not take the sildenafil. Or if he is on a nitrate therapy, for example, if he is taking the nitroglycerin or isosorbide mononitrate or isosorbide dinitrate, he should avoid, because all these nitrates is a contraindicated with the sildenafil citrate. And the last one is drug interaction. So the drug interaction means which are those medicines which we should not take with the sildenafil citrate. So these are the erythromycin, simtidine, ketoconazole, itraconazole, rifampicin, and those who are on a protease inhibitor for the HIV infection, he should avoid the use of sildenafil citrate, or if you are taking any alpha 1 blocker for hypertension, you should avoid the sildenafil citrate. And so these are the simple details information regarding the sildenafil citrate tablets, and it is always advised to that don't take any medicine without consulting any physician. And here our aim is to just to make you aware, which can help you when you will discuss with your physician. So thanks for watching this video. Have a nice day.